At the University of Regina, the Equity, Diversity and Inclusion Digital Resource Hub showcases impactful EDI initiatives across the campus.
It's a centralized, accessible resource for our community and post-secondary institutions nationally.
Join us to hear the stories behind the initiatives shaping our campus.
So I think that's a really good question in the sense that I don't think we have a strategic plan or a specific focus, but we do cover a wide range of EDI issues in our faculty. So it's everything from, we have Indigenous programming, for example, we take varsity sport teams out to First Nations communities. We have a focus on disability or individuals with a disability. We do things with within the community, for example, New Beginnings is programming that we offer for individuals from low-income families to be involved in sports. So there's a wide range of things. We also have things for older adults, people doing research in that area, but we also have programming like through Enrich and a cancer program. We do have people doing research on gender and girls, gender, but women and girls. So there's a wide range. Why those areas? I think in some ways it's a little bit of, it's directed by staff and faculty, what their research interests are in, or maybe where we have a connection within the community. So for example, we've got Tristan Hopper and Michael Dubnowick work with Growing Young Movers in North Central Regina and delivering programming through there and leadership. So it's really, it is a wide range and not specifically a directive from the dean or from our athletic director about this is what we're doing. It's much more organic and coming from the bottom up. So in that, again, I'm going to say that we don't necessarily have anything formalized. We've got a lot of lived experience, so people can always talk to someone if someone has gone into the community, what some of their experiences are like. But in the sense of actually formalized workshops, training, paperwork, things like that. It's not that we have a lot of that, but we can always find resources to support that. So again, whether it's reaching out to someone within the faculty who's done something like that, or to other institutions, universities, and things like that. So again, it's not that we don't have resources. Again, maybe it's less formalized. Maybe where I will say that we do have some things is like some of our programming. So that has been going on for many years, like the Sport for Life that Dr. Jim Jasuk does. So again, we've got that exists. If someone wants to replicate that, they can go talk to him. Again, the Growing Young Movers, if you want to talk to some of the faculty that are doing things like that, you can go talk to them and see how that they've worked that out. But things that are actually shared or are available on a website don't really have a lot of that. So again, not within the faculty, but I'm going to say that it is much more organic. So we do have individuals, for example, that do research or programming with individuals with disabilities, or a range of that. So it's just groups of individuals like Dr. Brenda Rossa-Kimball, working with Bonnie Cummings Vicarious through Astonished, and do programming, do research, support individuals that way. So it's more, again, that it just happens with people who work together to kind of deliver those types of things. So again, it's not formalized, it's not structured, but it's kind of making those connections of, it could be students, staff, faculty members, kind of helping each other out with the different kinds of delivery of programs that we do or research. So Enrich is a program that's offered by Dr. Cameron Mang, and it's for individuals. They do physical activity, personalized physical activity with individuals. So that's one of the programs that we offer to the community. It also provides students opportunities to work with individuals in the community. It gives him an opportunity to do research of like new things that they might be trying out, and opportunities for graduate students. That's one that we have. Sport for Life, that's offered by Dr. Jasuk, is an opportunity to showcase Indigenous students to the universities. So we bring them onto campus, but it's also a learning process for people on campus to understand Indigenous cultures and traditions like powwow, different dances. So we hosted in the gym. introduce students to this. So it's kind of bringing both together, really to learn and to highlight Indigenous cultures, traditions within our institution, but then also bringing Indigenous people onto campus to kind of maybe break those barriers that might have existed previously of what it's like to be on campus. I think there's a wide range of them. I think some of them is, whether it's directly related or not, I can't actually say that, but I think our student body is becoming more diverse, maybe not diverse in terms of disabilities per se, that's I think still a challenge, but in terms of ethnicities, we're seeing some of that, social class. I think that our attitudes and behaviors perhaps in the faculty are becoming more aware of EDI and how important it is. So whether it is being more excited to deliver programs like this to different individuals, it's embedded in a lot of our classes in many different ways, as opposed to it being just one person's responsibility. I think many people are taking up the cause, the issue, and kind of making it their own. So it doesn't have to be everything. For some people, again, it's more, they want to focus on Indigenous. For other people, it's individuals with disabilities. For myself, it's gender. So I think we just see that it's becoming more commonplace within our faculty. And I think and we're seeing it more in a lot of our non-academic programming as well too. So we do see some of our athletic teams doing sort of outreach or community outreach, like playing in different communities. So we have women's hockey that's doing that pretty soon. So I think it's just becoming normalized that it's not like a one-off thing, it's just something that we do and many people do in many parts of their jobs. I think there's always things to do. I think part of it has to be an awareness that it's not, as you just said, it's not a one-off thing, that this is something that is just normalized, it's accepted. I think there's lots of communities or issues that we still could go further with. I know, for example, trans athletes would be a big issue, and I'm not really sure how far we've gone in terms of recreation programs or athletics. So that's one that really haven't touched upon a whole lot. I think social class is still something that is challenging to do. For example, with our sport camps, I think we have some of that, but perhaps we could go further with that. So I think it's just, we have to recognize this as it's an ongoing thing. It doesn't stop. It's probably never going to stop. Ideally, we'd like it to be that everyone has access and opportunities, but I think there's always things that need to be considered. And then we also have to consider sort of the, I'll use an academic word, the intersectionality of it. So the idea of that if you're a person with a disability, but also on low income, how do we address sort of, and I don't want to say it's compounding, but sort of multiple types of EDI issues to support more people, being able to maybe access, again, our classes, our research helping more individuals. So I think there's still more we can do with it, and have to recognize that it's everyone's responsibility, and it just doesn't stop. We keep trying to expand what we do in more different ways. I think it's the idea that EDI is not a political issue, it's a human rights issue. That it's something that it's about respect for individuals. It's maybe not easy to always deal with, but I don't see it as, I think we politicize it, but it doesn't need to be politicized. It's just treating people with respect.